Thank you. I really want to thank, first off, I want to thank Oklahomans for taking this seriously. I want to thank our business community for continuing to innovate. We've heard from businesses all over the state who are allowing their workforce to work from home, or they're spreading their cubicles out and they're listening to the CDC guidelines to limit interaction of groups of 10 or more. So thank you for that. That's the guidelines from the CDC over the next 15 days as we're really trying to flatten the curve on this outbreak. The business community also, the restaurants have done a great job of continuing to innovate with curbside delivery, with curbside pickup. I actually ordered my lunch and went and picked it up at a restaurant here in Oklahoma City today, and it worked really, really well. So thank you for keeping us safe in that front. Also, to our healthcare workers, I just want to thank you as well. Our police, our firefighters, our first responders, to the nurses and the doctors who are working really hard, to our janitors, the people that are cleaning the facilities. You guys are doing a great job. I appreciate you. I have your back. Oklahomans appreciate you and stepping up in this time. Just this afternoon, we launched a one-stop website with resources you may need. You can go to covidresources.ok.gov and find resources about unemployment benefits if you are losing your job during this time, small business loans, and other things we are proactively doing to help Oklahomans. I know that there is a lot of anxiousness, there's a lot of fear and uncertainty, but again, Oklahomans, we are going to get through this together. We've been in rough times before, and we're going to come together as a community like we've never done, and we're going to get through this. Today, we had our first case of COVID-19 in a assisted living facility, a nursing home. And I have Steve Buck here with Care Providers of Oklahoma to give us an update on what steps they're doing to actively protect and clean and protect the patients there. We are also letting you know that across the state, we are critically low on our test kits, or more specifically on the the reagents. That's the fluid that goes into the swab, goes into making the test positive or negative. We have been and we will continue to be pushing very hard with the federal government to get more of those test kits here into the state. I've been on the phone with Senator Inhofe, Senator Langford, all of our federal delegation, as they're doing everything they can to push and help Oklahomans get more tests. As we're speaking right now, the Health Commissioner, Gary Cox, is meeting with leaders of private testing labs to figure out how to address this critical national shortage of test kits and reagents. Due to the critical low supply we have, the state is going to have to reserve, until further notice, tests for only vulnerable populations. Those who are experiencing severe symptoms. I had a call with a group of CEOs from hospitals across our state just today, and at this point, their capacity in their hospitals is good. But we have to remind everyone, there is no need to go to your emergency room, to go to your hospital if you are feeling sick. Your first step has got to be to stay home, call your healthcare provider, or call the hotline that we've set up. We have a 24/7 hotline. I want to give the number to Oklahomans right now. That number is 877-215-8336. That number again is 877-215-8336. If your symptoms escalate, they will let you know when and where it's time to go to the hospital. We are staying in touch with the White House on a daily basis, and they are asking all Americans to protect our emergency rooms. we have to protect the flux there from and keep it open for the most needy. Again, I want to emphasize this. If you get sick, you need your first step to be to pick up the phone and call either our 800 number or call your healthcare provider. Your doctor will screen your symptoms and they may tell you it's time to go to the doctor. But for many people, the best course of action is going to be stay at home. 80% of the people that get this virus are going to have very mild symptoms where rest at home, hydration is going to be all you need. I have Laurence Burnsed here, our state epidemiologist, here to talk about the urgent need for people to take personal responsibility during this time, to stay at home and practice isolation if they are beginning to resemble symptoms, and for all of us to continue to practice social distancing, continue to frequently wash our hands. I also spoke to the National Guard today, yesterday, the day before, and we are looking at the best ways to proactively use them to quickly deliver medical supplies and support to our hospitals and our first responders. Let me be clear. The National Guard, if we pull that lever, will be here to help us and to deliver supplies and make sure the supply chain is effective and efficient. But every Oklahoman has a job to do right now, and that is continue to come up with innovative ways to help our state. One example, the Seniors in Need program. That's for our needy seniors. They were eating in community, and our Baptist General Convention stepped up and turned that community eating into a drive-by delivery of service. So they're actually driving by, and our seniors in need are getting meals that way. They're also working on a way to deliver meals directly to our seniors' home. As we keep innovating, we will also need to protect public health, continue to practice social distancing, continue to work from home, know your risk, and protect yourself and your neighbors. We need everyone working together on this. And again, Oklahomans, we are going to get through this together. And I wanted you to hear from Laurence now, our state epidemiologist. So Laurence, let me turn it over to you.
Thank you, sir. So regarding the testing process, as Governor Stitt referenced, we need to go ahead and prioritize specific individuals that need to be tested for novel coronavirus. So we are advising our healthcare provider partners to please prioritize those individuals that have symptoms that are consistent with novel coronavirus, specifically fever, cough, shortness of breath, and that fall within specific high-risk categories. That would include individuals that are severely ill, whether through hospitalization or intensive care unit, or those individuals that are more vulnerable are high-risk groups that may be at risk of severe illness. So individuals that are elderly residents and individuals that have underlying medical conditions, specifically those that may affect their heart or their lungs, as well as those conditions that may affect their immune system. Furthermore, it would really help us in regards to our public health response to prioritize specific groups of individuals to identify outbreaks so we can put in appropriate control measures and to limit further spread within groups to help to reduce the impact on affected populations. And that is why we are also advising our clinical partners to prioritize those individuals that may be within groups that are have a suspected outbreak occurring. Specifically, if we have residents and staff that are within a long-term care facility or other group institutional setting. And finally, we want to ensure that we are protecting our healthcare provider partners and identify novel coronavirus within patient care providers to assure that we have a safe workforce and that we do not have the potential risk for exposure to their patients, and especially those that are at risk of severe illness, which is why we're also asking to prioritize those healthcare provider partners that experience acute symptoms of illness so we can test them. Unfortunately, because of the national shortage with specific supplies, and there's been several components that we've been discussing over the last several weeks. You know, initially there was a disruption in supplies of the actual SARS coronavirus kit that CDC produced. That was a short supply early on, and that's what's used to actually detect the virus in a specimen. Now we're dealing with an international shortage of the actual reagents This is a liquid that is utilized to manually extract the virus from a patient's specimen, which is why we have to go ahead and put in these specific priority groups. Finally, I want to go ahead and stress again that we ask everyone to follow the instructions for social responsibility, social distance, monitor yourself for symptoms of illness, work with us if you know that you may have been exposed to a person that has been diagnosed with novel coronavirus. Stay at home when you're sick. It is advised that if you're experiencing symptoms of fever with cough or shortness of breath, that you stay home until at least 3 days following your fever, with no fever, without the use of fever-reducing medication, and at least 7 days from your symptom onset. That will help us to reduce continued spread within our communities. Thank you. Yes, sir. Oh, go ahead.
Good afternoon. Governor, I thank you for inviting me to take part in the conference to share a few words with you about what is known to be the first confirmed COVID-19 case related to a resident of a nursing home, a member of Care Providers Oklahoma. What I need to explain, and I think this kind of provides an undergirding, if you will, to how complex this is the resident who has been confirmed to have infection. Actually, the point of diagnosis occurred in a hospital. The resident had been hospitalized 3 or 4 days ago, and the confirmation came just yesterday. And so that resident is not in the care home currently. That resident is most likely to discharge to the care of her own family as opposed to returning to the care home. This truly does represent a tremendous challenge for our state and communities. One thing I want to underscore is the providers that we represent are well prepared for infection control strategy. It is part of our licensure requirement that each of our providers have underlying infection control approaches that they are prepared to deliver in times of infection. These are highly skilled healthcare professionals who are competent delivering services to those residents who count upon us. This virus has created new challenges, and with those new challenges come adjustments to protocols. And what I can share with you is the CDC and CMS, our national partners, have provided clear guidance relative to restricted visitation and also significant restrictions to communal dining. Working with our partners at the State Department of Health as a regulatory agency, we've been working with them to make sure those are implemented. To our family members who have loved ones in care, I want you to know that we understand the frustration as it relates to visitor restriction. It's very important for our residents to have interaction with their families, and we hope that as family members, you're seeking opportunities through your healthcare provider to remain engaged. Perhaps it's an audio-video call over Skype or FaceTime, or perhaps it's a phone call, or perhaps it's written letters. We encourage you to remain engaged, and we do underscore our appreciation for your patience. Governor, Secretary Lothridge, Commissioner Cox, all members of the Cabinet, we have been very appreciative thus far of your response to the calls to need that we have placed. We've been very impressed with our partners in state government as we've moved to address the needs that are before us. The governor yesterday held a conference call that our team was part of, and that was very important, and we appreciate that dialogue. There will be more asks to come as we continue to address this challenge. But I'm very confident and appreciative of the fact that when those calls come in, those calls are answered, and we appreciate it. Thank you.
Okay, we want to open it up to a few questions from the press.
I know you said that we're dangerously low. Do you know exactly how many test kits we have left?
You know, I'll let Laurence speak to that, but it's a moving target. I mean, they're testing right now. We just know that we're really, really low, and we're going to have to reserve those for the most vulnerable population. Laurence, you want to add anything to that?
Yes, sir. Happy to. So in regards to our public health laboratory, as the governor mentioned, that is a moving target because we are receiving specimens throughout the day. We continue to operate and test the specimens that we receive. But for example, earlier this morning, our inventory started at just under 300, and we have already received over 200 specimens today. So if you kind of consider that, that means that we are down below 100 after testing those specimens. And we want to assure that we prioritize individuals that are most at risk, and we detect a highly vulnerable population potential outbreaks within institutional settings, which is why we have to work with our clinical partners to put in the specific priority groups. Now, of course, I want to stress again that really from the beginning of this response, not every individual has to be tested. As the governor mentioned, the vast majority of individuals will experience mild symptoms of illness that may last for several days with fever, cough, shortness of breath, fatigue, and so forth. those individuals with direction from their healthcare provider may be able to, or will be able to, essentially remain at home, isolate themselves to limit potential spread to other individuals in their household and other close acquaintances, and care for themselves with rest, plenty of rehydration, and with any instructions to monitor for any kind of severe symptoms based on their underlying conditions. If a person's symptoms continue to worsen, though, gradually increasing fever, difficulty breathing, labored breathing, rapid heart rate, then of course we would encourage individuals to stay in touch with their healthcare provider, follow their guidance if they advise that they need to come in, or seek care from a specific facility so that way they can be properly evaluated and manage if their symptoms do worsen.
Rest, plenty of rehydration, and with any instructions to monitor for any kind of
Hang on one
based on their
second.
underlying condition.
Hang on, we got
If a
one.
person's symptoms
Hang on one second. Can you
continue to worsen, though,
It sounds like
gradually
everything in
increasing fever,
Sorry about that.
Go ahead, I'm sorry.
Then we'll go to one.
Go ahead.
So you mentioned the most vulnerable populations. Is there any cutoff in terms of age or how bad their pre-existing conditions are? Who should just know they're not supposed to ask for a test yet?
Yes, sir. In regards to age, so what we rely on is really the data that's been that we've been reviewing, not just within our own population, but worldwide, as this novel coronavirus has spread. And we know that the individuals that are at greater risk of severe illness are individuals that are greater than 60 years of age, and those that may have underlying medical conditions specifically that affect their heart, their lungs, or those that affect their immune systems. That may be somebody that is going through cancer therapy, that may be a person living with HIV or AIDS, or other conditions that affect their immune response.
Is this directly in, I don't know, maybe we just, once we're done, we can go to the phone line. But
Is this is this opposite of what CDC's current guidelines are for testing? I mean, is this having to take a step back because we don't have accessibility?
Actually, it's not. When you look at CDC's guidelines, of course, they've had to be modified as the course of the pandemic has occurred. Early on, of course, during this response, the priority was to identify initial detection within the United States. So priority was to look for individuals that had recent international travel history to other outbreak-affected areas. But obviously, we know that we've had detection of local transmission, so that has shifted to look for detection within the United States and within Oklahoma that specifically focuses on specific high-risk groups. So, of course, we've relied on clinical judgment, and if there were more supplies available for testing, then there would be less needs to prioritize groups. But CDC's criteria early on has, at least in the last week when they modified the last criteria, has advised clinicians to prioritize these same high-risk groups.
right, and I've heard that guidelines are changing several times a day. Is that a fair assessment?
That is possible, and that's probably because of the supply chain issues that not only Oklahoma, but all states have been experiencing. So as we understand the epidemiology of this outbreak or this pandemic and understand which populations are more affected, then we might see a change in the specific high-risk groups or the specific priority groups for detection and response and further containment.
But yesterday, when there was a Senate staffer that tested positive, OU was able to come over here, mobilize quickly and test 30 people, I think, or more. So there are obviously tests available. But can you explain this whole public-private testing difference? Where were those tests done? I mean, how were they able to come over here and do that so quickly and get so many people tested who were asymptomatic, from what I understand?
Sure, that's a good point. So when we're talking about an investigation, when you have a confirmed case, our part of the investigation is to identify those close personal contacts at risk of exposure, and the core measure of containment is to implement specific control measures. So that would be for those individuals to be quarantined at their residences and monitor themselves for symptoms, and then speak with a healthcare provider if they were to develop symptoms. Screening or testing asymptomatic individuals is certainly not one of the priority groups. Now, some individuals may be able to access private testing, and there are some private laboratories that may be able to receive specimens that are collected from individuals, but there are delays in testing with specimens that are sent to private laboratories as well. Unfortunately, the supply chain for the specific reagents, both public health laboratories and private laboratories are trying to receive the same reagents from the same manufacturers. So although we were initially hearing that some of the commercial laboratories that hospitals use to send off specimens for private testing have been able to collect specimens and may send them, we're seeing disruptions where they may be able to for one day receive specimens, and the next thing you know, they are saying that they don't have the capacity to test because they ran in short supply. So honestly, I'm not sure exactly where they may have sent the specimens. or if they have even been tested. We know that some private laboratories that receive specimens, because they're dealing with the same back orders that we are, they are having to freeze and store specimens until those supplies become available.
Governor, with the new numbers that came out, one of the people that tested positive was a child under 4. Has there been any talk with shutting down daycares and stuff like that after that positive test?
You know, I'll let him talk about, do you know which one they're talking about? Under 4?
Just in general, I mean, not just that childhood, but daycares, since schools are also already shut down. I don't know if you're talking about the next step of shutting down daycares.
No, we're not, no plans to shut down childcare, daycare. Obviously, the social distancing, the groups of 10 or more, that's where we want those daycares to innovate on different solutions and separating the kids, doing a deeper clean. I was on the phone with the Hospital Association just today, and one of their requests were for their healthcare workers, with the schools being shut down, they need more access to childcare. And so that's one of the things, some of the church groups, I was on with a group of nonprofits and pastors today, they're wanting to know how they could help. And so through DHS and through my Be a Neighbor site, we have the licensing requirements set up for us to stand up more child care facilities and get that up and running as well, so we don't really overload the ones that are existing, but actually create more of the churches and the nonprofits to help there. But you know, we've got to keep our healthcare workers in the hospitals, and so I would not want to think about having to shut down child care as well.
The federal government has delayed tax payments and things like that. Are there any discussions for the local tax commission to do the same?
Yeah, so the federal government shut down, or they're requiring tax returns to be filed April 15th, but they're given a 90-day reprieve for interest and penalties. And we're talking about that in our budget discussions right now with the House and the Senate. Is there anything we can do to relieve that? One thing we are doing, our unemployment, I'm having that system kind of shock tested for the amount of people that will be applying for unemployment. We're looking at waiving the week-long requirements before you can receive unemployment benefits. We know that Oklahomans are going to be affected by this, especially in our hospitality industry, our you know, restaurants, the hotels, and so that's what I really want to try to help those folks get back on their feet and try to mitigate their problems as much as we can.
In your conversation with the Hospital Association, and Laurence, maybe this is for you as well, sir, but is there any talk about, or do you have any idea on the number of N95 masks that Oklahoma has? Do we have enough? Is that a shortage as well, or is that a shortage at the national level? Did that come up?
You know, the hospitals told us they've got orders coming in. They think they can wait till their next order shipment comes in on some of those masks. We have talked to, the health department has a strategic, they have a warehouse with some strategic supplies, so we're actually getting an inventory of that today, and I will be distributing that across the state to some medical facilities to make sure that we have what we need. So the state is prepared for that. We're getting an inventory, and I'll let Oklahomans know where we're at on that supply as soon as I get that.
It's kind of a weird time right now with the questions coming in just because reports are all over the place. Laurence, would you speak to if we have any information on when we're expected to get the next batch of tests in? And is there any way to tell how many tests we're expecting in that shipment?
So the question related to when do we expect to receive the next batch of the reagents specifically. We immediately have put in our order for the max number of reagents that we can receive, which is enough to test 500 specimens. And that all states are at the same max level, essentially. Once we put in that order, we were advised that unfortunately there is no specific delivery date, which is why we have to be very strategic right now with the limited supplies that we have to prioritize individuals that are at greatest risk and those that may be servicing or may be affiliated with very high-risk populations. So, you know, from our federal partners, unfortunately, they have not been able to provide us with a specific date of our next shipment. We are hopeful that it would be soon, even if it is just not even our max order, just something to assure that we can continue to respond to conduct investigations. But right now, no clear date.
Chemical name for that reagent? Is there a specific company that makes it? What color is it? I mean, what can you tell us about this?
I don't recall exactly what the company name that it is. It's a very limited number of companies, unfortunately. My understanding is that just a few companies are manufacturing this, and they are just not able to maintain the demand globally. When you have such a limited source for your supply chain for essentially all healthcare facilities and laboratories that are trying to order this from the same companies, that's where we're having the bottleneck right here. But off the top of my head, I just don't remember what the name of the companies are.
The White House has talked about different platforms coming online for testing. Will those require these reagents and things that are so hard to do? Or will that be a whole new system for doing that, make it easier to produce and to perform?
Right, good question. The question is, are there other platforms or other reagents that might be able to be utilized for novel coronavirus testing? And we know that there are several research facilities that are working on getting their additional platforms that are validated for novel coronavirus testing. That's in progress. That would help us alleviate some of the problems that we have with supply chain. That could potentially open up for other reagents that are produced that are utilized for those platforms. But right now, that's not currently available, and we hope that would be something that our research partners are going to be able to assist with.
Governor, you mentioned the homeless or out of the job as a station. I worked at a bar or hospitality. You mentioned you're talking about lifting that 1 week waiting period for unemployment. Just to clarify, have you done that yet, or is that just something you're looking at doing, and kind of why haven't you done that yet?
Yeah, so before, let me get back to, we also are in contact with our research universities. It's our understanding that some research universities in the state of Michigan are 2 to 3 weeks away from creating their own test for this virus. And that's my challenge to our universities. I've brought them together, the scientists, the research. I'll be having a call with them later on today to find out what they think their timeline is. And so that's something that we certainly want to get ahead of in case there's more further delays on receiving this reagent. Specifically on that, we're looking at the rules, whether we need legislation, whether we can make that rule inside the department, the unemployment department. But it is my intent, if it's in my power, to do it quickly. If I have to go through the legislature, I believe I can I've talked to them. I just had a call with the minority leadership today. I think they're on board with helping me with that. And it's something that I think we can get across the finish line, whether I do it by rules or we have to do it by legislation.
And while that happens, is there anything else available for these people?
The SBA, when I declared an emergency, that allowed our small businesses to go to the SBA for lending and some other assistance. Our federal delegation is working on some different stimulus packages that we think will help. Congressman Cole, Senator Inhofe, they all asked me, Congresswoman Kendra Horn, they wanted me to put in, because they're fixing to write the next stimulus package, what businesses are affected in our state, what we can do to get into the queue up there for further help. So I know our federal delegation is working on that as well. That'll be coming in the future. Let's take one call from the phone.
Our federal delegation is working on some different stimulus packages.
I just had a quick question for Laurence Burnsed, if it's my turn.
Yeah, it's your turn. Go ahead.
Okay. Mr. Burnsed, Tiffany Alaniz from Fox 23 News in Tulsa. Just sort of a two-tier question for you. We've heard in other states where they're using antivirals in some of the hospitals among some of the patients. Can you speak to that, and if that's something that the hospitals here are considering once our patient load increases? And then also, Dr. Briggs this morning in the White House briefing said specifically that they are becoming increasingly concerned watching the data from France and Italy about the number of people in their 20s and 30s who are in the ICU right now. What is your concern, or what would your message be for millennials and people in those age groups today that obviously when they addressed it in the White House briefing this morning, it is obviously something that they are closely watching?
Sure. So regarding antivirals that are being utilized in some hospitals, so when we're talking about a large-scale event like this, a pandemic event response, there are several strategies that are going on at once. One is the public health response, of course, to try to deal with detection, containment, and mitigation. The other one is the clinical research that's happening to help us expand the tools that are available to help us reduce the burden and the impact on our population. And so there are clinical trials that are occurring where we are evaluating antiviral medications and see about the effectiveness of those antivirals to help to reduce the severity of symptoms among those that are infected with novel coronavirus. If you reduce the severity and duration of illness, that helps to alleviate the impact on our hospital and healthcare system, and it helps to reduce the potential risk of death from severe outcomes from novel coronavirus. And that's the same research that's also occurring with vaccines. You've probably been hearing a lot about the vaccine trials that are starting to kick underway. Of course, that's not anytime in the very near future, but there are trials that are starting to look at the effectiveness of a couple of the vaccines that have been recently developed. Regarding the occurrence of illness among individuals that are millennials, your younger age groups, as I referenced earlier, our high-risk population, of course, there's part age and then there's also underlying medical condition. So the age factor is greater than 60 years of age. Those individuals in general may be at high risk of severe illness. Now, persons of all age are going to be at elevated risk if you have certain underlying medical conditions that affect your immune system. So if you have conditions that affect your heart, your lungs, your general immune system, those individuals that may have diabetes, that may be persons living with HIV or AIDS, they could also be at higher risk. So that brings up a very important point, which we're trying to stress, which is that in order for us to be successful in mitigating the impact of novel coronavirus in our communities, we have to make sure that everybody is following the guidance, not just individuals that may feel like they are at greatest risk, because we have to recognize that individuals that may just experience mild symptoms, they may not be too concerned personally about the impact on them, but we have to remember that our family members that are at higher risk, our loved ones and close acquaintances, and of course our general community members, they are the ones that are going to be worried, and they're the ones that we also have to protect. So you essentially have to remember and think about the importance of protecting yourself, protecting your loved ones, and protecting your community.
Thank you, everyone.